where they are getting lectures, seminars, because I do everything with informed consent. Is this person reliable? Is this person accountable? I lead them, I guide them to do the research, but it really gives them networking opportunities. They're looking for clinical skill because the reality is, look, not everybody coming in. Some of them may be just community psychiatrists and it's completely okay. Then they're looking for cultural competence. Today in the clinic, we have ketamine infusion going on.
Good morning, good afternoon, good evening. Today we have Dr. Parikh with us and a very fantastic preceptor. A lot of our students have gone to her. They do their rotations and in fact also some research. So we wanted to sit down with her to understand how the rotations work and how students can leverage that to match along with research. So welcome, Dr. Parikh. We are very glad you're here.
Thank you very much, Mr. Pawan. And I am very excited about our meeting tonight. Looking forward to a lot of good students coming from Sarthi.
So, Dr. Parikh, let's talk about you first, a bit of a background. Where did you do your med school or residency and, all those kind of things, just to...
Sure. So look, part of it, I actually went through similar process. I am a US citizen, but I went to Ross University in Dominica, West Indies. And so when I came back, I had to go through my step 1, step 2, step 3 CSA. So I kind of know the process. This was, of course, 30 years ago, Pawan. I did my adult psychiatry training at Brookdale University in Brooklyn. And after that, I continued on to child and adolescent psychiatry at Weill Cornell Medical College, New York Presbyterian Hospital in New York. And essentially, that is where a lot of my clinical and research experience was solidified. And I continued to be assistant clinical professor at Cornell at present time. So where I am now is I'm in full-time private practice. I'm the medical director of Second Arc Psychiatric Associates, which is a clinic which offers services to Westchester County, where we have other psychiatrists, we have nurse practitioners, PAs, and then I have ketamine of Westchester, which is ketamine infusion clinics. So I have one clinic here in Westchester County and one in Brooklyn. And other than that, I have TMS of Westchester as well. And I also serve as a school psychiatrist for Westchester County school districts. A lot of different hats that I wear, aside from my assistant clinical professor role.
This is great. Excellent. So let's talk about, the student rotation. So what is a day in the life of a student as they start with you? How does it work?
Sure. So look, I'll give you a general idea and then specific details. Mondays, Tuesdays, Wednesdays, I am in Westchester office. 9 to 5 essentially is a normal work day, but the day doesn't stop there because a lot of my students, who I've trained so far from Sarthi, but they all have been excited and involved in research. So I'll tell you more about it. So in the morning is the morning rounds. The day typically starts with morning rounds. They meet with me, they meet with other supervising psychiatrists, nurse practitioners, PAs. We're discussing overnight events, treatment strategies, and then they sit in on the interviews with us. We are constantly supervising them. They're not left alone, where they learn interview taking skills, treatment planning meeting with the patient, with their families, with their caregivers. And in between that, they have reading and research time in between patients' visits, because I do everything with informed consent. So if the patient is uncomfortable, the students will actually utilize that time for reading and research, where they'll prepare for psychiatric disorders, treatments, recent advances. I lead them, I guide them to do the research to really deepen their understanding and support their learning. Once the patients are comfortable, they do patient interviews with me, where they learn comprehensive psychiatric examination, mental status examination, and essentially learning how to build rapport with patients, assessing mood, assessing dangerousness, assessing suicidality, assessing patients' thought process and behaviors. And then in the afternoon around 1 to 2, we have a lot of these pharmaceutical drug wraps that will come in. And that's my case discussion time, where I'll often have them engage in case discussion with the other treatment, multidisciplinary treatment team. Along with that, throughout the day in the clinic, we have ketamine infusion going on. So while they will not be administering ketamine directly, they will be paired with my ketamine nurse or ketamine clinician, and they'll be actively involved in the ketamine process as well. So a lot of action going on. Then again, from 2 to 4, we have more didactic sessions where they are getting lectures, seminars, other treatment strategies to really complement. This is more practical learning experience. And then, of course, I teach them how to document as well. And at the end of the day, we kind of debrief. Now, Thursdays, I go to my Brooklyn office where the day pretty much looks very similar. Monday, Tuesday, Wednesday, and Thursday. And then Friday, I go to school districts. So I take them with me where we're meeting with different teachers, other clinicians, occupational therapists, physical therapists, speech and language therapists. So very interactive conferences going on. And then on Tuesdays, they attend grand rounds at Weill Cornell Medical College in the hospital.
Yeah.
So that's essentially, it's a very busy rotation that's pretty much 9 to 5, but that kind of continues into 6, 7, 8, depending on the student's initiative.
No, this is excellent. This is very, very comprehensive. And also, you mentioned about research. So let's talk a bit about how students use this time to research with you, because I know you are a prolific researcher as well, and many of our students have done research with you. So as part of this rotation, how does that work?
So look, let me give you my background. At Cornell, we were expected to write 5 peer-reviewed papers to essentially even maintain our status as instructor or assistant attending or assistant clinical professor. To really go from one level to another, you had to actually have some sort of meaningful peer-reviewed publication done. Having said that, I've written enough book chapters on eating disorders. Once upon a time, when I worked at Cornell for 13 years, I was the chief of eating disorder division and chief of emergency room, actually. So I have extensive experience working with patients. And even in my practice right now, we have over 3,000 patients. So really, why is academic research important? As I told all the 17 students that I've had so far, is that really, look, everybody can get their great scores on USMLE 1, USMLE 2, USMLE 3. What really sets you apart from other resumes for program directors, for hospitals who don't know you, really, it makes you competitive. When you have academic research, you really, as an applicant, stand out. Programs are often looking for students, kids who have contributed meaningfully to academic research. It shows commitment to the field. It shows their approach to learning. It really shows their ability for analytical skills, right? Because research allows them to have critical thinking, problem-solving abilities. And these skills, believe it or not, are invaluable in clinical setting where diagnosis and treatment are often necessary. So yes, everybody will learn their DSM-5 and learn their treatment planning in their residency training, but what really sets students apart is what work have they done, what initiative have they shown, how much in-depth knowledge they have. And research essentially allows residents, medical students to kind of dwell deeply into this specific area of interest, providing a richer understanding to these programs of who these students are, right? It also shows commitment and passion. If you look at Dr. Kanuja Sood, Dr. Lajpat, Dr. N. Fusoda, all these students came through Sarthi. They actually are just getting publication out in Journal of Child and Adolescent Psychopharmacology with one of the world's top researcher, who's a good friend of mine, Dr. Henry Nazarullah. So all these, I believe 7 to 8 kids, but they all got a publication with Dr. Nazarullah under my supervision. So these really opportunities for publication in peer-reviewed journals, very esteemed, prestigious journals. They published at conferences, they presented at conferences. All these are evidence to this residency program of applicants' hard work and contribution to the field of psychiatry, right? And they actually essentially directly and indirectly, but signal these programs that I am serious about my academic and professional growth.
Yes, absolutely. Absolutely.
The other thing these research opportunity does is when they go out and present, right? We went and presented to API, we went and presented to, I believe, at APA, but it really gives them networking opportunities. So that's where they meet these program directors, they meet this chairman, chairwoman, but it really allows them to interact on a more sort of higher level, indicating that they're ready for professional connections and mentorship. So overall, what sets apart two candidates with same scores is really their 2 or 3 or 5 pages of research. So my rotation, very clear requirement that they sign is each student is supposed to produce 2 papers, minimum 2 papers in a month rotation. And not only that, let's say if I have more than one student. So for example, I believe in June and July, I had over 4 or 5 students. August, September, we had 3 students. But the rule is that if there are other students, you are essentially involving everybody and putting their names on the paper by giving them appropriate work. So when you leave this place, you actually have 6 papers instead of 2. So again, teaching them a lot about collaboration, a lot about partnership, right? So it really allows them, it's going to open up their sort of academic opportunities. And I can tell you that all the kids that just even rotated between May and pretty much September, they're all going for their matches. Each one of them has somewhere between 6 to 8 interviews in local area, New York area hospitals, which is incredible. I feel like this is what I think you absolutely must really stress to the students coming in, that I don't want them to come here just for clinical rotation to come and hang out here. That's not what I'm looking for. This is a very highly demanding rotation. So, but if they are committed, as I tell students, I will work as hard as you do. Right? I will not work harder than you. But if they're very committed, I am all in for them.
Yeah. So thank you. Thank you. Next question. So, you've worked at Weill Cornell and you have a lot of academic experience working with program directors also. So in addition to research, when it comes to the clinical skills or counseling skills, what are these program directors looking for in an interview when they see someone having done US clinical experience?
Absolutely. So look, as I tell students, first thing, they are looking for academic excellence, right? They're looking for strong performances in medical school, including their grades, board scores, the students' ability to handle demands of the program. They're looking for clinical skill. Has this student demonstrated competence in clinical setting, right? And when they do this rotation here, they've learned the American way of patient management, and that helps. More importantly, they're looking for their communication style. Is this student an effective communicator with the patient, with the families, with the healthcare team? Are they a team player or not? Program directors in general, they value candidates who can clearly and compassionately convey information, right? They're looking for, is this person professional? Is this person ethical, right? And they can kind of skim through all this when they read their research paper. Is this person reliable? Is this person accountable? Does this person have respect for colleagues, other multidisciplinary, interdisciplinary team, right? These are all very critical components of any program, any job in general, but particularly when you work with patient care. Then they're looking for cultural competence. What makes my program, my clinic, on one hand, I have the clinic which serves essentially diverse, multi-ethnic, multicultural group. Other hand, I have a very diverse population of a lot of Orthodox Jewish community that I treat. So what programs need to know? Are these students culturally competent? Does this student have teamwork approach? Does this person have interpersonal skills? Right? Is this person really interested in psychiatry, or they just want to be in America and just get their foot in the door? Right? Is this person engaging in research activity, scholarly activity? Has this person demonstrated any initiative or interest in any form of academic medicine? And then the other thing is, remember, all these residency programs, they're also raising future leaders. So they're looking for, does this person have any leadership qualities? And if so, what are the evidence of taking initiative? I tell people that when I was at Cornell, I came here as a child psych fellow, but soon my chairwoman and my program director, they all kind of realized the leadership quality, and they were literally grooming me. And that's what I'm doing to my candidates here from Sarthi, right? So leadership qualities, initiative. Does this student take initiative? Very important. And then the other things are adaptability and resiliency, right? Is this person able to cope with stress in life and adapt to this fast-paced, rapidly changing environment, or this person is going to fall apart? So that's all very relevant, or these are all relevant component of any residency training that any program directors are looking for in any residency candidate.
Yeah. So you mentioned about the demographics, but in terms of the patient pathology, what can a student expect to do or see? What type of patients? What kind of
Sure. Say, listen,
cases?
2,000 patient is a lot of patients, and they see somewhere from just a regular ADHD, learning disability, anxiety, depression, to acute psychosis and acute mania in my office. So one of the things I'm known for is complex psychopharmacology. So most of my patients have been to 1, 2, 3, 4 other doctors before coming to me. So they see a gamut, a very wide sort of classification of DSM-5 disorders. Not only that, we actually have one of the largest LAI, long-acting injectable clinic, which is what we use for acute management of um, bipolar disorder, acute management of schizophrenia. So they're really getting cutting edge treatment management that are not even happening at academic hospital level.
Mm.
So they go in there. I can tell you, like one of my students who was with me for a couple of months, at this point, she went for interview, and I believe 2 or 3 out of 5 programs, they actually wanted to know, well, how do you set up the ketamine clinic? How do you treat the patient? What do you do? What doses do you use? How do you do LAIs? Like they have the information, they haven't done hands-on, right? So that is huge for these kids to go out there, being foreign medical graduates, and be able to talk about this,
Yep. Mhm.
right?
Uh, Finally, as students come to you, what do you expect them to know, or what kind of prerequisites, whether in terms of knowledge, in terms of skills, do you expect them to have?
So as I told, look, I think my rotation is very, very demanding. It's very, very challenging. It is really meant for people who are committed to go to psychiatry. I do plan to, Shella and I were talking about it, where we could probably divide the rotation into just clinical experience, clinical plus the research, and then somebody if they just want to come for research. Because the reality is, look, not everybody coming in. Some of them may be just community psychiatrists, and it's completely okay. So I have found some students who will come in here not realizing the demands of this rotation, my rotation particularly. So I hope that one of the things moving forward is that if we can exchange their CV or resume for me to understand what's their foundation, what's their knowledge base, so then I can challenge them accordingly. So I think it'd be very helpful to gather their CV, their resume, particularly their research experience. And as you even recruit these students, to say, do you want to just do the clinical, which is a 9 to 5 community psychiatrist, nothing wrong in it, right? Or do you want to enhance your resume, getting some publications out? So that's what I would recommend students to kind of have that either option or clear understanding of what they're getting into.
Okay. Well, thank you very much, Dr. Parikh. This was great, very extensive, and hopefully our audience and potential students, they realize the importance of this rotation. And as we get ready for the match, we'll send you a lot of these students.
Absolutely. I look forward to.
Thank you. Let me stop the recording.
Sure.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.